Exercising is important to obtain the best results from your total hip surgery. Some exercises are important for flexibility. Other exercises are important for strength. You will start learning the exercises for your home program after surgery while in the hospital. You will notice that your post-operative exercises are very similar to the exercises you started before surgery. The exercises in this section are the beginning exercises that you will start in the hospital and continue into your initial physical therapy sessions after the hospital stay. Your outpatient, home health, or subacute rehab physical therapist will add further exercises as you recover and get stronger based on your individual needs. Your exercises should be done while lying on a bed, sitting in a chair, or standing, depending on the exercise. Do not perform the exercises while lying on the floor due to your hip precautions. Exercises should be done twice daily. Patients usually start with 20 repetitions while in the hospital, progressing to 30 repetitions as directed by their physical therapist. Ankle pumps are done to encourage circulation, prevent blood clots, and are helpful for your balance. Gently pull the toes up towards you and then push them away again. Do both ankles either together or alternating. After surgery, ankle pumps should be performed throughout the day. Quad sets strengthen your quadriceps or thigh muscle, which is important for standing, walking, and going up and down stairs. With both legs flat, slowly tighten your thigh muscle, your quadriceps, while pushing your knees down into the surface. To emphasize the quad muscle, you may also try to bring your toes up towards your head. Look and feel for the muscle above the knee to contract. If done correctly, the heel may slightly lift off the surface of the bed if you have enough range of motion. Hold the muscle contraction for 10 seconds. Do not hold your breath while you count. Glute sets, or buttock squeezes, work the gluteal muscle, which is important for standing, walking, and going up and down stairs. Squeeze buttocks together as tightly as possible while still being comfortable. Hold for 10 seconds, remembering not to hold your breath while you count. You can check to see if you're doing the exercise properly if you see a gentle rise of your hips up off the bed, and when you relax, they sink back down again.
Hip abduction works the gluteus medius muscle on the side of the pelvis. This muscle is very important for walking. Hip adduction works the inner thigh muscles, which also help in everyday movements, such as walking and getting your leg in and out of bed. Slide your surgical and non-surgical leg out to the side by spreading your legs apart, moving the legs only as far as comfortable. Keep your kneecaps and toes pointed straight up towards the ceiling, and don't let your leg rotate in or out. You can help keep your leg straight by tightening the muscles on the top of the thigh as you move your legs in and out. Perform this slowly with a 5 count out and a 5 count in. Sometimes it may be difficult to slide your leg across the bed if your mattress is too soft or if your bed covers have too much friction. You may find it helpful to put your leg in a plastic garbage bag when performing the exercise, making it easier to slide. If your bed or mattress is too soft and you feel like you need to lift your leg in order to clear the surface, you can make the bed surface firmer by placing a sheet of clean cardboard or a plastic surface over the top of the mattress underneath your leg.
Heel slides work your hip flexor muscles, which are important for walking and going up and down stairs. Bend your knee and pull the heel towards your buttocks, actively sliding the heel along the bed. Sometimes it may be difficult to slide your leg across the bed if your bed's too soft or the bed covers give too much friction. You may find it helpful to put your leg in a plastic garbage bag when performing the exercise, making it easier to slide. If your bed is too soft and you feel like you need to lift the leg up to clear the surface, you can make the bed surface firmer by placing a sheet of clean cardboard or plastic surface over the top of the mattress underneath the leg. The short arc quad strengthens your quadriceps or thigh muscle, which is important for standing, walking, and going up and down stairs. This exercise requires a firm towel roll about 6 to 8 inches in diameter. You can make a rolled towel by using a large beach towel. Fold it into half or thirds depending on how wide it is. Roll it up nice and tight. You can secure it with some rubber bands or tape. Some people find it easier to wrap a towel around an old coffee can. To perform the exercise, place the rolled towel under the exercising leg. Lift your heel off the surface and straighten the leg by tightening your thigh muscle or quadriceps. Make sure you keep your knee on the roll when you're straightening the leg. Hold for 5 seconds. Remember to work for full extension, straighten the knee. If you have someone assisting you, they can place their hand under your heel to help. Sitting knee extension or long arc quads strengthen your quadriceps or thigh muscle, which is important for standing, walking, and going up and down stairs. Sit in a chair comfortably with your thigh resting on the chair for support. Slowly straighten your leg and hold it for 5 seconds. Lower your foot back down so it is resting on the floor. You should try to completely straighten the knee, but you do not want to lift your leg so high that your thigh starts lifting off the chair. Remember, the motion is at the knee.
The bridging exercise is an advanced exercise to work your buttock muscles. These are important for standing up from a sitting position, walking, and stairs. Lie on your back with your knees bent and your feet flat on the surface. Keep your feet and knees hip width apart. Push down through your feet as you lift your hips up from the surface, concentrating on pushing equally through both sides. Hold for a 5 count and then return to the start position.
Mini squats are a more advanced exercise to strengthen your quadriceps or thigh muscle, which is important for standing, walking, and going up and down stairs. Stand next to a counter or a firm surface. Holding lightly to the counter is needed for balance. Bend your knees and lower yourself several inches to a partial squat position. Try to keep your knees behind your toes during the entire motion. Slowly straighten back up. Standing heel and toe raises are a more advanced exercise for your ankle strength, which is important for balance. Stand next to a counter or firm surface. Hold on to the counter as needed for balance. Raise up on your toes. Lower back down slowly. Now rock back on your heels by lifting your toes up. Lower toes slowly, back down, and repeat. Standing hip abduction is a more advanced exercise for your side hip muscles, which are important for walking. Stand next to a counter or firm surface. Hold on to the counter as needed for balance. Lift leg out to the side a comfortable distance. Lower slowly back down. Try to keep your leg in good alignment, moving only out to the side. Don't let it move in front of your body.
Single leg stance strengthens important leg muscles for walking and for your balance. Stand holding onto a firm surface and slowly lift your operated leg, concentrating on your support leg for balance. Balance and hold for 10 seconds. When you have adequate healing, your physical therapist will direct you to start putting more weight on your surgical leg. Repeat by standing on the surgical leg, again concentrating on your balance. As you progress, hold very lightly with your fingertips, then eventually progress to lifting your hands slightly above the surface and progress your balance in this way.